In this 10-minute video, you'll learn spinal-specific exercises to improve the mobility of every joint in your body. I'm Dr. Craig Dingman, and I've created this video for you to follow along and improve your spinal mobility every morning. Hope you enjoy it. So let's start with range of motion and mobility of the cervical spine. First, we're going to do protraction and retraction of the head. So these are jaw juts and retraction, forward and back. 5 in a row. Good. Then we'll look at head rotations, so rotating side to side, all in the pain-free range of motion. Don't push it here, all pain-free. Then we'll focus on side to side. Oh, head up, head down, extensions and flexions. Same thing, nice pain-free range of motion. Good. And then lateral bending, tilting your ear to shoulder on both sides. Careful with this one. Most people are really tight with this one. Again, in the pain-free range of motion. And then we're going to make circles. These are turtle circles. Keep your shoulders stable. Move your head around in a circle. Both directions. Good. Stabilize the shoulders. Move the head from side to side. Just laterally shifting the head side to side, keeping your shoulders stable. All right, then we'll move on to some range of motion of the shoulder. Small circles with your arms down. First forward. Really focus on movement at the shoulder ball and socket joint. First one direction and then reverse it for 5 circles each way. Arms above the head, same thing. Small circles in one direction. Straight up, arms straight up. Good, and then reverse. Arms, small circles, straight up. Side again, small circles, arms at the side. Great. These are crankshafts, so we're really focusing on rotating that shoulder blade. All the movement here should be in both directions. She's doing backwards now. She just switched to forwards. Crankshafts, moving the shoulder blade, sliding it and gliding it over the rib cage. And we'll move to Egyptians. Again, really focus on rotating the shoulder. Even through her sweater, you can see Shauna's shoulders really rotating. That's great. Then we'll move to elbows. So elbows in, feeling that right, locking out at the end of the range of motion. And out. Always both directions, moving that joint through its whole range. And we'll work on wrists. We're doing wrist rolling. Rolling in both directions, really trying to isolate that motion at the wrist, feeling them roll in both directions. And then we'll move into flexion and extension of the wrists. These ones are going to be good for any of you that ever work at a computer or a smartphone or a tablet. You have your fingers locked in one position with tiny movements all day. Fingers and wrists never go through a full range of motion. Shauna was just moving them side to side. And we're going to work on fingers. Again, usually just your index finger is working the mouse clicker. We want to make sure all of them move like this through all ranges of motion. The thumbs in particular, thumbs rarely get worked when we're at the computer. Rounding the thumb one direction, then in the other. Good. We're going to move on that thoracic spine. So most of us sit, whether in a car or at a chair at a computer all day. Anyone ever get mobility problems with their upper thoracic spine? This one's really good. Hugging the barrel. See her upper back and shoulder blades really moving there. And then we'll tuck the pelvis. Again, the low back gets tired from sitting, especially in a soft chair. This is a really good one to do throughout the day. It's tucking that pelvis forward and back. Extension and flexion. And we'll move the pelvis side to side just by dipping one knee forward each time. Again, really concentrate on the hips. Isolate that movement side to side at the hips. Next, you're going to need the back of a couch or a chair or a pole if you've got one. You can just unthread the broom off the end. And let's work on hip mobility here. Back and forward, back and forward. You can bend your knee slightly on the back swing, but keep it straight on the front swing. And move that through a full range of motion. You can even get a little ballistic motion here with swinging. Good. And then we'll do hip in and out as well. Side to side. Now try and keep your upper body stable as much as you can. You want to really focus this motion into the hip joint. Good. Hip rotations out. And switch hip rotations in. Again, through that whole range of motion. Nice. Let's give that leg a rest. We'll switch legs. Let's do the forward and back with the left leg. Again, bending slightly on the back, but getting a bit of a swing, ballistic motion kicking forward. Should be able to get a real nice stretch through the hip joint here. And then out side to side. We'll switch, keeping the upper body nice and stable. Really focus on movement at the hip. Good. And then we'll move into small circles, one direction, then the other. Sitting really tightens up the hip, joint capsule, all the muscles around it. This range of motion done in the morning and even a couple times throughout the day will give your body a break from that sitting posture that shortens and tightens your hip muscles. Great. Next we'll work on knee mobility. Try and keep your femur, your upper leg bone, parallel to the ground, so your hip and knee at 90. Just flex that joint forward and back. And then we'll do small circles one way and try and isolate this at the knee joint. And then the other way. Always switch directions. Good. And we'll switch. We'll do the other leg. Give the right leg a break. And again, knee forward and back. This is an excellent one you can do sitting in a stool for those of you that have ever had any knee problems. Get a high stool, circles in and out. Get a high stool so that you can swing your leg freely. Just free that leg, swing that leg forward and back at the knee. Great for knee mobility and if you've had knee problems. Next, let's go and do some ankle mobility. So we'll do flexion and extension, or dorsiflexion and plantar flexion at the ankle. Good, and then eversion and inversion. So move that foot up and out. And we'll do circles. Do the whole range of motion, both directions. One way, then the other. Good. We'll work on the toes. Just gently putting pressure down on the toes and extending them up. Not too much pressure, you don't want to hurt those toes. And carry your weight on the broom handle there. Good. And then inversion and eversion. Be careful when you put pressure down on the outside of your ankle here, especially if you've had ankle sprains in the past. Good, let's switch legs. Go back to our flexion and extension. Good. These next ones are a little tough to coordinate, the inversion and eversion. If you can get them, they feel good. Yep, and circles, both directions. Nice. Go back to our toe mobility. Again, just putting some gentle pressure down on the toes and then extending them up toward the ceiling. That's great. Eversion and inversion. Remember again, gentle pressure, especially on the inversion on the outside of the foot there, particularly if you've had ankle damage in the past. And you're done. Have a great day.